Sure. Hey, Megan, can you hear me?
I can.
Okay, perfect. And I don't see if Jerome's on yet, so
I am.
do.
I'm here.
Okay, perfect. Perfect. Good. I haven't. You haven't popped up in my Hollywood squares yet, so good.
I'm ever present.
There you go. Well, as Megan said, we do have a lot to hopefully accomplish today, so we do want to kind of jump right in and get us started for today. So we do have some guests today from the Board of County Commissioners. So I would like to thank all of the commissioners that have joined us today, and we'll do a roll call for you all in just a moment. But we do want to go ahead and kind of take care of a little bit of business, and then we'll jump in. So we do want to go ahead and discuss the agenda quickly. So we'll approve the minutes. We'll do a little framing for our county commissioners that have joined us today on the task force and what we've come to accomplish thus far and how we've formed everybody into groups. And then we will dig into the meat of our work, and all of our subcommittees will present what they have been working on. Everybody's got about 15 minutes. We will hold questions to the end for commissioners. So if you'll just hold your questions for our subcommittee members till all three subcommittees are done, and then after we take questions from our county commissioners, task force members, we will go into any Q&A that you all have for our guests today, and then we'll just hopefully have a minute or two to wrap things up. But we do want to jump in and go ahead and call for a motion to approve our February 3rd, 2021 minutes.
This is Kevin Kendrick. I move to approve.
Any seconds?
Second.
Martina Ward, second.
And if you don't
Thank
mind,
you.
chat box that Kevin, you and Marcinia approved those, made a motion. Thank you.
Okay. So moving on, so I'll formally introduce myself. I'm Victoria Vramovich. I am one of the co-chairs on the Mecklenburg County COVID-19 Task Force, also serving with Jerome. Jerome, did you want to take a second to introduce yourself?
Yes, Jerome Williams. I am with Novant Health and co-chair with Victoria of the task force, and happy to welcome all the Board of County Commissioners who are in attendance today to listen to some of the great work that's been done so far, and to entertain questions as well.
Great. And Jerome, did you want to talk a little bit about the process of how we've come together from September through now and kind of frame things up?
Yeah, absolutely. If you can go to, great, you went to the next slide. So as you're well aware, the Board of County Commissioners passed a resolution establishing the Mecklenburg County COVID-19 Recovery and Renewal Task Force. And there were, a number of impact areas that were outlined for this activity. As you can see, the impact areas, I believe there's 10 in total, and it's a wide expanse of activities that we were tasked to address. Now, part of the initial efforts of the task force really was how do we put together this wide area of activity into buckets that we can clearly focus on. There was some uncertainty, and there was some lack of clarity initially as to how we would approach this work. So we actually took the resolution, excuse me, we took the resolution and we actually broke it down and created a mission statement to simplify and strategically pull together all the action items from the resolution. We then set out and said, hey, there are many different areas that are overlapping, and really none of the areas are in isolation. So we decided to break up the work into really three subcommittees or three areas. We then offered up to the task force members the option of choosing which subcommittee they would like to be part of. And it was very intentional that we wanted individuals to be on subcommittees that were not necessarily in their subject area of expertise. So if an individual professionally was engaged in healthcare, for example, we really wanted those individuals to lend their expertise in voice in other committees. We then tasked the subcommittees to develop and establish a leadership structure within the group. Who is going to be the lead of the subcommittee, and then set up a regular cadence of meetings and agendas for those particular subcommittee members. Victoria, do you want to add anything to that?
No, I think that covered it. That was really our way of trying to organize this vast body of work that we all had ahead of us, and we had to break it down in some way so that we could make it consumable. And I think thus far, I feel like we've been the subcommittees have been successful at taking a chunk out of these large assignments that they have been given, and I think that's a great summation, Jerome. Thank you.
Okay.
So next, I'm going to talk just a little bit about where we're going, things that we have on our calendar, milestones for the work product. When we first began work in September, we had initially put together this high-level kind of timeline and milestone chart, working from September to September, giving ourselves about 12 months to get this work done. Obviously, I've cut out the months where we've already passed, but I wanted to just give our board of commissioners just a little bit of view of where we're going through really the winter, spring, and into fall here. So right now, all the subcommittees are still kind of doing their data dive, pulling together information, really trying to understand, the typical strengths, weaknesses, opportunities, and threats within their impact areas. And then looking through spring at really starting to pull that information together, wrap up research, and then as we come into late spring and early summer, bringing everything back as a task force so that we can pull recommendations from subcommittees together into one final report or product that we provide out to the Board of County Commissioners. But looking at July, really spending time once we have those really kind of formalized recommendations and working on the evaluation component of it. I think that's something that's very important for everyone on the task force, is for us to be able to accomplish and measure success within these recommendations. And we'll also have, I think, a lot of assistance from the wonderful county staff to support us in making sure that we develop metrics that will be realistic. With us looking at pulling everything together with a final product towards September. So that's just very high level of where we're going right now, to give you an idea of kind of the timeline, and also a refresher for our task force members on where we are in that continuum. Of course, having flexibility with anything else that comes our way that may change this. But we will, as we are broken out, working in subcommittees, doing a lot of the work really towards the beginning of summer, we'll really come back together as a large group and start working on approving and really just kind of rounding out recommendations together as a team. Okay, next slide. So, Jerome, is this your slide or mine? I can't remember.
I believe this is your slide.
Okay.
The only other thing I wanted to add, Victoria, to the previous slide, you don't have to go back, is that we want to emphasize that we didn't really want to recreate the wheel. There are a lot of programs and services that are currently in existence, and other programs and services in other counties and other states that we feel could be used and adopted to some of this work. So it really is not so much recreating a brand new wheel, but often elevating and connecting the dots of a lot of programs and services that may already be in place, and how do we enhance them, how do we bring those to the forefront. That's the only other thing I wanted to add, Victoria.
Great, thank you. So with that, we are going to jump into our subcommittee presentations. And first up, we have our Public and Government Services Subcommittee. And presenting for them is Harold Rice. And you also see these are also the members on this slide, as well as the county staff person that is assisting